A very good morning to all the doctors and everybody who have joined the webinar today. It's a pleasure for us to have you all here. This is Dr. Shivangi Singh, and I feel very fortunate that I have gotten this opportunity to represent the topic in front of you all today. So, thank you very much to RX and Vision Publication for giving me this opportunity to represent this topic in front of you all today. So let's begin with the introduction. I'm going to the next slide, that is introduction. Diabetes mellitus, more commonly referred to as diabetes, a chronic disease associated with abnormally high level of glucose in the blood. Diabetes is due to one of two mechanisms: inadequate production of insulin, which is made by pancreas and lower blood glucose, or inadequate sensitivity of cells to the action of insulin. Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defect in insulin secretion, insulin action, or both. The chronic hyperglycemia of diabetes is associated with long-term damage, dysfunction, and failure of different organs, especially the eyes, kidneys, nerves, heart, and blood vessels. This high blood sugar produces the classical symptoms of polyuria, that is frequent urination, polydipsia, frequent thirst, and polyphagia, increased hunger. So as we discussed in these above slides, diabetes is a chronic metabolic disease characterized by elevated level of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerve. Diabetes happens when your body isn't able to take up sugar into its cells or into it for energy. This results in a buildup of extra sugar in your bloodstream. So it results your body doesn't make enough insulin and can't use it as well it should. When there isn't enough insulin or cells stop responding to insulin, so too much blood sugar stay in your bloodstream over time that can cause serious health problems such as heart diseases, vision loss, and kidney diseases. So basically, there isn't a cure yet for diabetes, but losing weight, eating healthy foods, and being active can really help. Other things can do to help, like take medicines as prescribed by your physician, doctor, get diabetes self-management, education, and support, make and keep health appointments. Basically, a human being eat food, not glucose. Human food get converted into glucose as a part of the normal digestion process. Once converted, glucose enter the bloodstream, causing the level of dissolved glucose inside the blood to rise. The bloodstream then carries the dissolved glucose to the various tissues and cells of the body. Now the next slide, incidence. Some 34.2 million people of all ages, about 1 in 10, have diabetes in the US. Some 7.3 million adult age 18 and older are unaware that they are diabetic. The number of people who are diagnosed with diabetes increases with age. More than 26% of adults age 65 and older have diabetes. So several pathogenic processes are involved in the development of diabetes. These ranges from autoimmune destruction of the beta cells of the pancreas with consequent insulin deficiency to abnormalities that result in resistance to insulin action. This basis of the abnormalities in carbohydrates, fat, protein actions. The basis of the abnormalities, as I told you, is carbohydrate, fat, and protein metabolism in diabetes in deficient action of insulin on target tissues. The deficient insulin action result from inadequate insulin secretion or diminished tissue responses to insulin at one or more point in the complex pathway of hormone action. The impairment of insulin secretion and defect in insulin action frequently coexist in the same patient, and it is often unclear which abnormality, if either alone, is the primary cause of the hyperglycemia. Now the next slide, sign and symptoms of the diabetes mellitus. The symptom of diabetes includes increased thirst, weak tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, unplanned weight loss, frequent urination, frequent unexplained infection, dry mouth. Some other symptoms are in women, dry, itchy skin, frequent yeast infection or urinary tract infection. In men, decreased sex drive, erectile dysfunction, decreased muscle strength. Now the next slide. There are three types of diabetes. That is, type 1 is insulin dependent diabetes mellitus, type 2 is non-insulin dependent diabetes mellitus, and the third one is gestational diabetes. So the first type is diabetes mellitus, that is insulin dependent. This type is autoimmune diabetes disease, meaning your body attack itself. In this case, the insulin producing cell in your pancreas are destroyed. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults. It was once better known as juvenile diabetes. People with type 1 diabetes need to take insulin every day. This is why it is also called insulin dependent diabetes mellitus. So the risk factor of type 1 diabetes includes having a family history of type 1 diabetes, injury of the pancreas, such as by infection, tumor, surgery, or accident. Presence of autoantibodies, that that mistakenly attack your own body, tissue, or organs. Physical stress, such as surgery and illness. Exposure to illness caused by viruses. After that, the causes of type 1 diabetes mellitus. There is an immune system disease. Your body attacks and destroys insulin producing cell in your pancreas without insulin to allow glucose to enter your body or cells. Glucose bind up in your bloodstreams. Gene may also play a role in some patients. Also, a virus may trigger the immune system attack. Now, the symptoms of type 1 diabetes mellitus. Basically, symptoms can develop quickly over a few weeks or months. Symptoms begin when you are young, as a child, teen, or young adult. Additional symptoms includes nausea, vomiting, stomach pains, yeast infection, or urinary tract infection. So this is all about the type 1 diabetes mellitus. Now the second slide is about type 2 diabetes mellitus, and this is non-insulin dependent diabetes mellitus. With this type, your body either doesn't make enough insulin or your body cells don't respond normally to the insulin. This is the most common type of diabetes. Up to 95% of people with diabetes have type 2. It usually occurs in adults, onset middle age, and older people. Other common name of type 2 includes adult onset diabetes and insulin resistant diabetes. Your parents or grandparents may have called it having a touch of sugar. So the risk factors of type 2 diabetes mellitus are same family history, parents or siblings of pre-diabetes or type 2 diabetes, having overweight and obesity, having high blood pressure, having low cholesterol, being physically inactive, being age 45 or older, having gestational diabetes, or giving birth to a baby weighing more than 9 pounds. Next factor is having polycystic ovarian syndrome in females, having a history of heart disease or stroke, and the last, being a smoker. This is the main cause we considered as a risk factor of diabetes type 2. Now the causes of type 2 diabetes mellitus are your body cells don't allow insulin to work as it should to let glucose into its cells. Your body cells have become resistant to insulin. Your pancreas can't keep up and make enough insulin to overcome this resistance. Glucose levels rise in your bloodstreams. The symptoms that occur in the type 2 diabetes mellitus, you may not have any symptom at all or may not notice them since they develop slowly over several years. The symptoms usually begin to develop when you are an adult. but pre-diabetes or type 2 diabetes is on the rise in all age groups. The next type is gestational diabetes. This type develops in some women during their pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you are at higher risk of developing type 2 diabetes later in this life. So the risk factor of gestational diabetes includes family history. As I told you, in above all these two types of pre-diabetes or type 2 diabetes, having overweight and obesity before your pregnancy, being over 25 years of age. The causes of gestational diabetes: hormones produced by the placenta during your pregnancy make your body cells more resistant to insulin. Your pancreas can't make enough insulin to overcome this resistance. Too much glucose remains in your bloodstream. The symptoms of gestational diabetes can be: you typically will not notice symptoms. Your gynecologist will test you for gestational diabetes between 24 and 28 weeks of your pregnancy. There are some complications of gestational diabetes, basically with the mother, that is preeclampsia. As you all know that the preeclampsia is a stage: high blood pressure, excess protein in urine, leg feet swelling, the risk of gestational diabetes during future pregnancy, and risk of diabetes later in life. And the complication of gestational diabetes in a newborn baby: the higher than normal birth weight, low blood sugar, that is hypoglycemia, higher risk of developing type 2 diabetes over time, and death shortly after birth. After that, let's discuss some less common type of diabetes. There are three less common type of diabetes. Number one is monogenic diabetes syndrome. These are rare inherited form of diabetes, accounting for up to 4% of all cases. For example, are neonatal diabetes and maturity onset diabetes of the young. The next type is cystic fibrosis related diabetes. This is a form of diabetes specific to people with this disease. The third is drug or chemical induced diabetes. Example of this happen after organ transplant following HIV and AIDS treatment are associated with glucocorticoid steroids use. I want to discuss little about the diabetes insipidus. Diabetes insipidus is a distinct rare condition that causes your kidney to produce a large amount of urine. Now, I want to discuss about the complication after the types. So the complication of diabetes: in your blood glucose level remain high over a long period of time. Your body tissues and organs can be seriously damaged. Some complication can be life-threatening over time. So the complication basically includes cardiovascular issues, including coronary artery diseases, chest pain, heart attack, stroke, and high blood pressure. Nerve damage, that is neuropathy, that causes numbing and tingling that start at the toes and finger, then spreads. Kidney damage, that is nephropathy, that can lead to kidney failure or the need for dialysis or transplant. Eye damage, retinopathy, that can lead to blindness, cataract, glaucoma. And the other complication are foot damage, including nerve damage, poor blood flow, poor healing of cuts and sore. Skin infection is also a complication in diabetes mellitus, can be seen. Erectile dysfunction, hearing loss, depression, dementia, and dental problems. These are the complications of the diabetes mellitus. Now the management. The management of the diabetes mellitus: diabetes affect your whole body. To best manage diabetes, you will need to take steps to keep your risk factor under control and within the normal range, including keep your blood sugar level as near to normal as possible by following your diet plan, taking prescribed medication and increase your activity level, exercising regularly. Try to exercise at least 30 minutes most days of the week, walk, swim, or find some activity you enjoy. The other management: maintain your blood cholesterol, and triglyceride levels as near the normal ranges as possible. Control your blood pressure. Basically, I'm explaining the slides in the details. Now, the other managements I want to discuss, that is planning what you eat, following a healthy meal plan, follow a Mediterranean diet like vegetables, whole grains, beans, fruits, healthy fats, low sugar or DASH diet. These diets are high in nutrition and fiber and low in fats and calories. Achieving a healthy weight, work with your healthcare team to develop a weight loss plan. Taking medication and insulin if prescribed and closely following the recommendation on how and when it to take it. Monitoring your blood glucose and blood pressure level at home. Keep your appointment with your healthcare providers or doctors, having a laboratory test completed as ordered by your doctor. And the most important management is quitting smoking if you smoke. At the last, I want to discuss about the preventions. So the prevention of diabetes mellitus, the type 1 diabetes can't be prevented, but the healthy lifestyle choices the help treat prediabetes, type 2 diabetes and gestational diabetes can also help prevent them. So the preventions are eat healthy food, choose food lower in fat, calories higher in fiber, focus on fruits, vegetables and whole grains. Eat a variety to keep from feeling bored. Get more physical activities. Try to get about 30 minutes to moderate aerobics activities on most days of the week, or aim to get at least 150 minutes of moderate activities a week. For example, take a brisk daily walk. If you can't fit in a long workout, break it up into a small session throughout the day. Lose excess pounds. If you're overweight, losing 7% of your body weight can lower the risk of diabetes. Now, I'm giving you an example. If you weight about 200 pounds, that is 90.7 kilogram, and you are about to losing 14 pounds, that is 6.4 kilograms, can lower the risk of diabetes. But don't try to lose weight during pregnancy. Talk to your doctor or gynecologist about how much weight is healthy for you to gain during pregnancy. So this is all about diabetes from my part. Now I'm going to present one live case in front of you. So a male patient of age 56 years reported at my clinic with a complaint of calf muscle pain in both legs, mostly at night, with burning of soles, dryness of skin with cracks, with frequent desire to pass urine followed by burning and disturbed sleep. In case taking the history of present illness, the patient was apparently healthy 15 days before. Then he started complaining of profound weakness, overpowering sleep, hot flushes, incontinence of urine, increased frequency of urine, frequent urging for urinations, cramps in lower limbs, dryness of the skin, and tendency to diarrhea or sweatness. So the first cause of breakdown of health, the death of his son, 6 years of age, never been well since. Now the past history of my patient, he had a past medical history of renal calculus with no surgery, the history of nasal polyps and allergic rhinitis. He had 2 sinus surgery, once in 2015 and one in 2016. The family history, father had diabetes mellitus type 2 and his mother is having hyperthyroidism. These are the investigation of my patient. There is much elevation from the normal ranges. You can see here in HB1AC glycerated hemoglobin. You can see here this is much more than normal. Its normal range is between 4.2 to 5.7 and my patient value is 8.50. This is much more than normal. And in the second report, you can see the fasting blood sugar. In this, you can see much elevation from the normal range, as I told you this. So I'm going to the next slide. The mentor generals. Before going to the next slide, I want to discuss little about my patient. When he visited OPD, he had already done a blood sugar level test. The fasting level is 177 mg per dl. As you can see in this slide, he had advised to start allopathic medicine, but he denied and wanted to start homeopathic medicines. Hence, he visited the homeopathic OPD. The personal history of my patient is the economic status of my patient is sound. In food habit, he has desire for fruits or juicy things, and vaccination histories, all the milestones were achieved normally. Now, the mental generals, impaired memory, cannot collect his thought or find the right word, aversion to talking, answering, homesickness with inclination to weep, hopelessness, tendency to diarrhea, and sweatiness. The physical generals of my patient. Appearance, fatty. My patient is having fatty appearance. Taste, sweet foods. Thirst, large quantity for cold water. My patient is having desire for large quantity of cold water. Stool, constipated with ineffectual urging and better by cold drinks. Urine, frequently desire to pass urine. Appetite, reduced. Declination to eat generally. Sleep, the patient did not feel refreshed in morning. Thermal reactions, chilly. My patient is chilly. Okay. Now I'm going to share my screen with you. So this is Dr. Shivangi. I will be demonstrating you how you can get started with RadarOpus and how can we repertorize the case. Before I start, I want to explain the viewers how this interface works. On the right hand side of your panel screen, you have a short chat box. You may type your question or whatever message you have right there, press button and send to it. So I will be sharing. So whenever you open your RadarOpus software, you will be able to see your screen in this way. The synthesis treasure is by default open. These icons are known as icon bar or toolbar. These 5 icons which are present on the left side of this vertical line are known as primary icons, consist of repertories, references, patient management, remedies, and families. So for doing the repertorization, I'm going to this repertories icon. After clicking on this icon, all the list of repertories will open here. Now I'm going to do my repertorization from the synthesis Adonis. Basically, it is a new repertory and it is a successive version of synthesis treasure. Now I'm going to repertorize my case with the help of this repertory, and for doing the repertorization, I will be needing few icons. The first icon is this binocular, find rubrics. After clicking on this icon, you'll get this navigation window. You'll get all the chapters that are belong to this particular repertory. So I'm going to repertorize my case with the help of this RadarOpus software and with the help of this synthesis Adonis today. So the first symptom of my patient is having aversion to talk. So aversion to answer. So answer is a mental symptom. For that, I'm going to the mind chapter. Now I'm typing here, my patient is having aversion to answer. He don't want to talk to anyone. He don't want to answer any question of anyone. So I'm typing here, answering. Aversion to answer. Now, this is my rubric. From mind chapter, answering is my rubric. Aversion to answer is my sub-rubric. Now, I'm going to add this rubric into the clipboard. Basically, these are the clipboards. They are just like our repertorial sheet. For doing the repertorization, I'm just adding this rubric into the clipboard and it will automatically get repertorized. For adding any rubric into the clipboard, you have 3 methods. Basically, the 3 methods we are having. The first method is drag and drop. I simply drag it and drop it into the clipboard. The next two method I am going to tell you with my two subsequent rubrics. The next symptom of my patient is very forgetful while speaking any word or sentence. So forgetful is also a mental symptom. I'm going to the mind chapter. Mind. Patient is forgetful. I'm typing here forgetful. Words while speaking of. So this is my rubric from mind chapter. Forgetful is my rubric. Word while speaking of is my sub rubric. Now I'm going to add this rubric into the clipboard with the help of second method, and my second method is plus key on my keyboard. I simply press the plus key on my keyboard and you can see here my rubric has been added into the clipboard. The next rubric I'm going to take, my patient is having the problem of weakness of memory. He's facing the problem of loss of memory. So memory is also a mental symptom, loss of memory. So I'm going to the mind chapter, memory. Weakness of memory. So this is my rubric from mind chapter, memory, weakness of memory. Now I'm going to add this rubric into the clipboard with the help of my third method. And the third method is this icon. Take the current rubric icon. After clicking on this icon, you can see here my rubric has been added into this clipboard. Okay. The next symptom of my patient is having the problem of perspiration during diarrhea. So for diarrhea, I'm going to the rectum chapter, rectum, diarrhea, perspiration during. The patient is having the problem of perspiration, sweating during the time of diarrhea. Now I'm going to add this rubric into the clipboard with the help of first method. As I told you, my first method is dragging and dropping. I simply drag it and drop it into the clipboard with the help of my cursor. Next symptom of my patient is having a burning pain while urination. So for burning pain while urination, I'm going to the bladder chapter, bladder, pain, burning. This is my rubric from bladder chapter, pain, burning. My patient is having the problem of intense pain and burning. So I'm going to add this rubric into the clipboard with the help of second method. My second method is plus key on my keyboard. Now the next symptom of my patient is having the problem of frequent urination. So for frequent urination, I'm going to the bladder chapter again, bladder, urination, frequent. Now you can see here, this is my rubric from bladder chapter, urination is my rubric, frequent is my sub rubric. Now I'm going to add this rubric into the clipboard with the help of third method. My third method, as I told you before, the third method is take the current rubric icon. After clicking on this icon, you can see here my rubric has been added into the clipboard. The next symptom of my patient is having the burning sensation in soles, burning soles. So for burning soles, I'm going to the extremities chapter, extremities, heat. Wait a moment, heat. Now, feet, soles, feet, soles. I'm typing here, soles. So this is my rubric from extremities chapter. Heat is my rubric. Feet, soles are my sub rubric. Now I'm going to add this rubric into the clipboard with the help of my first method. And first method is dragging and dropping. Okay. The next symptom of my patient is having the pain in calf muscles. So extremities chapter, I've already opened here. So extremities, pain, legs, parts. So this is my rubric from extremities chapter. Pain is my rubric, legs, calves are my sub-rubric. Now I'm going to add this rubric into the clipboard with the help of second method, the plus key on my keyboard. I simply press it and my rubric has been added. Now the next symptom of my patient is having the dryness on his skin, this dryness of his skin. So I'm going to the skin chapter. It is a journal rubric. I'm going to take skin dryness. This is the rubric of my patient, the symptom of my patient, complaint, skin dryness. From skin chapter, dryness is my rubric. Now I'm going to add this rubric into the clipboard with the help of first method. Drag it, drop it. The next symptom of my patient is having the desire for fruits. So I'm going to the journalities chapter, desire for fruits, journalities, food and drinks. I'm going to type food and drinks. Fruit, desire. Now this is my rubric from journalities chapter. Food and drinks are my rubric, fruit, desire are my sub rubric. Now I'm going to add this rubric into the clipboard with the help of first method, drag and drop. I simply drag it and drop it. Now the last symptom of my patient is having weakness, generalized weakness in morning. So I'm going to the generalities chapter. Now I'm going to type here weakness morning. The patient is having the problem of weakness while rising up in the morning. I'm typing here morning, weakness, morning, rising. After aggravation. So this is my rubric from journalities chapter, weakness, morning, rising after aggravation. Now I'm going to add this last rubric into the clipboard with the help of my third method. And my third method is this icon, take the current rubric icon. I simply click on it. I can see here my rubric has been added into the clipboard. So now I'm going to my clipboard. So this is the analysis of my case. I'll get all the chapters, rubrics, sub-rubrics, and I'll get the probable remedies and the grading of my remedies, that is 25 out of 11, 19 out of 10, 18 out of 10, 18 out of, so these are the probable remedies. As phosphoric acid is my highest grading remedies among all these probable remedies. So I'm going to prescribe this acid phos to my patient. Now I'm going to back to my slide. So this is a prescription of my patient. I have prescribed phosphoricum acidum 200 was prescribed with state orally, Seclec BD for 5 days. So the journal management I have prescribed to my patient is, patient was advised for regular exercise for 35 to 40 minutes per day, eating small meals at short regular intervals, including fiber-rich food, avoiding high calories diet, practice pranayama and meditation. So in the next follow-up, you can see here, the second follow-up of my patient is slight relief in pain in calf muscles, decreased burning pain after urination, but burning of soul as it is. I have prescribed phosphoricum acidum 200 single dose state orally again with Seclec BD 10 days. The management I have prescribed to my patient, along with medicines, counseling was also done to calm the mental irritability and other complaints. Now the third follow-up of my patient. In third follow-up, you can see here the marked relief pain in calf muscles. There was no burning pain after urination with decreased burning in soles, and decreased desire to pass urine frequently. There was marked improvement in dryness of skin and cracks, irritability decreases, like to talk with others. So at the last, I have prescribed Seclet BD for 10 days. So this was all about diabetes mellitus and how can we repertorize the case with the help of synthesis Adonis and RadarOpus software from my part. So, all right, now I would like to request all the viewers to comment in the chat box with their questions now. We will begin the question answer session. So a learner wants to know, explain about diabetes, pre-diabetes. Okay, pre-diabetes. This type of diabetes is a stage before type 2 diabetes mellitus. Basically, your blood glucose level are higher than normal, but no high enough to be officially diagnosed with type 2 diabetes. I hope is it clear? All right, now I would like to take the next question. The next question from the viewer side is, what are the complications of gestational diabetes? Okay. So as I told you in my above slides, the complication of diabetes with mothers, there's a problem of preeclampsia, that is high blood pressure, excess protein in urine, leg, feet swelling. The next complication with mother is risk of gestational diabetes during future pregnancies and risk of diabetes later in life. And the complication with the newborn baby, higher than normal birth weight, low blood sugar, that is hypoglycemia, higher risk of developing type 2 diabetes over time, and death shortly after birth. So the another question from a viewer side is, can diabetes cause blindness? Yes, actually, because uncontrolled diabetes can damage the blood vessel to the retina and blindness is possible. If you have not been diagnosed with diabetes yet, but you experiencing a change in your vision, see primary healthcare provider or a doctor or ophthalmologist as soon as you can. Now I'm going to take the next question from the viewer side is, what is an A1C? Okay, hemoglobin test. Are you asking about the hemoglobin test? That is, hemoglobin A1C is a 2 or 3 month average of your blood sugar. This results give you a good idea of how well your diabetes is being managed or controlled. The American Diabetes Association recommends an A1C of less than 7 to keep the risk of complication low. So I think we have almost taken up all the questions. So let's take the last question up from the viewer side. Will exercise help my diabetes? Exercise, yes, exercise is very beneficial in the management of type 2 diabetes. Always consult with your doctor about exercise guidelines to exercise safely and reduce risk. Okay, no more question, I guess. Okay, so let's wind up here. Thank you, everyone. I would like to thank all the viewers, the homeopathic fraternity who have joined us here today. Thank you so much. Thank you again for joining us. Having a great day. Keep learning, keep improving.